Welcome to Adapting Class. Thank you for deciding to watch this video. I know you're working really hard. It is time to work smart. These are 12 questions. I call them top NCLEX Review Questions because they are high yield, straightforward by critical thinking. There's no fluff. It's just exact critical thinking questions you may see on the NCLEX. I'm going to walk you through step by step how to analyze them, keyword, use common sense, and build your confidence so that we can ace these exams. So stick around and let's work through it. Let's go. First question. As usual, you know it's adapting class way. Similar like the NCLEX, but it's content-based. Which of the following client statement requires the nurse to withhold the medication and notify the provider? That's the buzzword. That's why I put it in red to emphasize concept. That means something is wrong. When the patient says something, you have to listen and talk to the provider. What is the problem? Go for the buzzword now. A nurse is preparing to administer fluphenazine to a client with schizophrenia. NCLEX test taking strategy, adapt NCLEX way. I know the buzzword. This medication. You take it for schizophrenia. Something should tell you this is antipsychotic. Number one, you already aced the exams. Now, what is the problem? Require the nurse to withhold the medication. Those are keywords. What is being asked? What is the case? What is the buzzword? Now rewrite the question. If a patient taking fluphenazine and they're telling you 4 of these statements, one of them should concern you. Which one? I feel really sleepy today. 2, my mouth has been really dry. 3, I had some trouble urinating today. 4, I have been hearing voices more than usual. What do you think? 4 things you're supposed to know. You should be aware of it. What do you think? Fluphenazine is what? Antipsychotic. What are the major side effects of antipsychotic? Bring your content. What kind of pharmacology do you have? If you need more, check Adapting Class. I have a bunch of mental health pharmacology that will help you answer this question. Fluphenazine is what? Antipsychotic. It's a first generation antipsychotic. Which of these symptoms should concern you? That's all. I give you 10 seconds to answer that. I feel really sleepy today. My mouth has been really dry. I had some trouble urinating today. I have been hearing voices more than usual. What do you think? And this is the trap. Number 4 is the trap. It's wrong. Straightforward, right? It's wrong. Patient has schizophrenia and is hearing voices. That's hallucination. It's suspected in that patient. That will even tell you they need more medication. Either we need to increase the dose of the medication or add another medication. But it doesn't prevent you from stopping the medication. Had some trouble urinating today. Side effect, anticholinergic side effect. So this is a problem. My mouth has been really dry. Antipsychotic, anticholinergic side effect. I feel really sleepy. Antihistamine side effect associated with fluphenazine. Which of these should worry you? First, we can take it away. But then the 2, dry mouth and bladder distension, you take bladder distension over dry mouth. If there's a pupillary dilation, I'm going to take it. So this is how you prioritize anticholinergic side effect. Pupillary dilation, what? Urinary retention, constipation before dry mouth. So this patient, number 3, is the right answer. Number 4 is designed to trap you. He's hearing voices because he has hallucination. That's why he's taking what? Fluphenazine. We may increase the dose or we will change to another medication, but it does not prevent us from what? Holding the medication. There's a key word here. Number 1 is out, Adapting Class. Number 2, which of the following statement by the nurse indicates a need for further teaching? That means does not understand the content analyzed in the answer choices or what the nurse is saying is wrong. And this is reviewing teaching point after attending a staff education session on metformin. Once again, stop the video, come out with your answer, and let me show you how I'm going to approach this question. Indicate need for further teaching. I underline it, and now my eyes on it. Of what? Metformin. That's all. I don't care about any word in the question anymore. That means which information about metformin the nurse is repeating or saying that need further intervention. Rewrite the question on your own. I will monitor my client's kidney function. Yes, because metformin affects the kidney. Metformin may cause nausea and diarrhea first few days. Yes, because it causes GI upset. It causes hypoglycemia when taken without food. Metformin increases insulin resistance. It does not stimulate insulin. Metformin should be withheld before a CT scan with contrast. Test taking strategy number 1 and number 4 are saying the same thing. Therefore, what do you think? 1 and 4 are all wrong since they're saying the same thing. 3 and 4 are your answer. 2 and 3 are your answer choices. Which one is saying something wrong that need further teaching? Metformin is what? Improve insulin resistance. It does not increase insulin secretion. Therefore, it does not cause hypoglycemia if you don't take it with food. Therefore, number 3 need further teaching. And this is the way you use the content to answer the questions. Have you seen these questions before? Do you want to run away from it? Stick around. I know you got it. Don't run away. These select or apply are straightforward. It's the same thing. Forget about the table. Don't picture the table. Pretend there's no table. And this is a single select or apply question. That's all. And this is assessing a 5-year-old who present with what? Cough, right? Respiratory problem. Which of the following findings indicate respiratory distress? That's all. Therefore, what do you think? Respiratory problem, non-productive cough. Does that indicate respiratory distress? Restlessness. Does that indicate respiratory distress? Inability to sit still, or climbing more skin, or nasal flaring, or use of accessory muscle, or intercostal muscle retraction, or grunting. I use all these words for you so that you can know what are signs and symptoms of respiratory distress. These are all words in the B-Sharp. If you don't know the B-Sharp, check out the class and learn how to use them for prioritization. In the B-Sharp, you will see that non-productive cough, this is a problem. Restlessness is also a problem. Inability to sit still is a form of hypoxia, right? Your skin is clammy and moist. It's also a sign of hypoxia. You basically have hypoxia that can sometimes affect your overall general well-being. Your skin is clammy because there's no oxygen. Nasal flaring is a problem. Of course, use of your accessory muscles is also a problem. When you have intercostal retraction, it's also a problem. And the worst of all, the last thing you do is grunting. That is the impending respiratory distress. Know all these words and never forget them. Number 4, and this is providing care for a client who has what? Diabetic ketoacidosis. Which of the following finding the nurse should expect or not expect? Same thing. Don't run away from it. Write it down. DKA. That means I should have diabetic problem, I should have ketones, and I should have acidosis. The answer choice is there in the name. Look at it. You should have diabetic related issue. You should show some signs of ketoacidosis, and therefore the answer choice is right there. This one says metabolic alkalosis. The name say acidosis. Therefore, this is not expected. If you have acidosis, you got to get rid of your acidosis through a respiratory alkalosis or what? Respiratory acidosis. What do you think? If I have an acidosis, I should compensate with what? Respiratory alkalosis. And how do you show respiratory alkalosis? Cushman breathing expected. Of course, if I have ketones, I'm going to have Uri order. If I have DKA, I have what? Loss of fluid, dehydration. That's the number one thing you use to treat them when they present in the emergency room. Therefore, do you think they're going to gain weight or lose weight? No weight gain. Abdominal discomfort is associated with the dehydration. So if you don't know, this is what it's going to be. If I'm dehydrated, I'm going to get weak. And if I'm dehydrated, I will try to drink more. Qualitative here. Content mastering, using it to answer the question. Don't study in vacuum, but try to apply those knowledge. And this is what these 12 questions is designed. NCLEX Review Questions, the top 15, 12, I call it, to help you master your NCLEX content. I'm just using them to show you how you should apply your content. Which instruction by the nurse is most appropriate? The nurse is providing teaching instruction to a client following inguinal hernia repair. You may not have heard about it before, but this is a repair. It's a hernia repair. Hernia repair, you need to do something after the surgery. The reason why you develop hernia sometimes too much intra-abdominal pressure. Therefore, every answer choice to prevent recurrence is based on preventing intra-abdominal pressure. Which of this is going to prevent intra-abdominal pressure? Sleeping on the operative side to not increase intra-abdominal pressure, right? Resume heavy exercise as soon as possible. You don't be able to do that right away. You got to wait. Emptying your bladder, right, often will prevent pressure, right, through the bladder distension. Avoid heavy lifting is what? This is direct intra-abdominal pressure. So when you resume activity right away, it's going to do the same thing, but all four of them, there's a clue there, right? Which instruction is most appropriate? Think about it. The questions say, which instruction should the nurse provide is most appropriate? Sleeping on the operative side is not a good idea. It's going to cause more pain. Resuming heavy exercise is going to increase intra-abdominal pressure, so we should not tell them to do that. Emptying their bladder, yes, it will increase that, right? Avoid heavy lifting will do that. But which one has the direct effect? Heavy lifting is direct. Avoiding emptying your bladder often is not direct. You just encourage them. When you feel your bladder getting distended, go empty it. Therefore, 3 is not the best answer. 4 is the best answer. This is the thing why you have to follow this. Most is direct. That means avoiding heavy lifting is the best answer choice here. The nurse is caring for a client who is 12-hour post-abdominal hysterectomy. The nurse notes that the client's blood pressure has dropped abruptly. Hypotension. What do you do? Which action is the most appropriate? Reassess the blood pressure in 30 minutes. Do you have time? Assist the client to ambulate to promote circulation. Somebody is hypotensive, is working. Think about it. Place the client in a high follow position. Be sharp. When you select the answer, always be sharp. Is it a breathing issue, shock, sepsis, airway? And what do you do when I have shock? Notify the healthcare provider. Can you do something before the healthcare provider comes? You got to be sharp. You have 1 second. Hypotension in a patient. I'm not going to lift them up. I can do something before I call the doctor. I won't wait for 30 minutes. Therefore, what? Assess the client to ambulate is by the idea. Place the client in the high follow position by the idea. That will cause more hypotension. Reassess the blood pressure in 30 minutes is a bad idea. Therefore, what do you do? let the doctor know. There's no answer choice there that you have to do something. This is the way I want you to think. You expect for you to take certain action, but the only best action is to notify the healthcare provider. If you place the client in a high follow position, is a problem. Assisting the client to ambulate is going to fall down. Reassessing in 30 minutes, you don't do anything. Therefore, when you see these questions, you said, okay, I need to do something, but the things I need to do giving me is a bad thing. Therefore, I should call the doctor. Number 4 is your best choice. Right here. This is the way you should think sometimes. You don't like calling the doctor, but this one, you got to call the doctor because of the answer choices given. A client is caring for, a nurse is caring for a client with major depressive disorder who suddenly stopped taking sertraline. Which of the following findings should the nurse suspect? Selected apply. Read the question from the back. Selected apply. That means you have a bunch of answer choice, 7 of them. You don't need to pick everything. Pick those you are confident. If you know only 2, pick the 2 and don't over-select. Don't be greedy. Which of the following findings should the nurse suspect? An expected finding. The nurse is caring for a client with what? Major depressive disorder. And he's taking what? Sertraline. Identify the medication. This is SSRI. SSRI, when you stop taking it, you can have rebound symptoms. What are the symptoms? Dizziness, agitation, insomnia, weight gain, electric shock-like sensation, nausea, irritability. What do you think? If you don't know, I will give it to you. Most of the symptoms is dizziness, agitation. You can't sleep anymore. You don't gain weight. Weight gain is one of the signs and symptoms while you're on the medication. Electric shock-like feeling. You feel like you're zapping your brain. You have nausea and irritability. Therefore, the only wrong answer choice is this. All these are right. All the answer choices are all signs and symptoms of withdrawal from SSRI. I'm using this to teach. Number 7 is a teaching question. Which intervention should the nurse expect to include in the plan of care? Do something, right? The nurse is planning post-op care for a client who has undergone vertebroplasty of the lumbar spine. What do you do? Position the client in the high follow position for 6 hours. Encourage ambulation within the first hour after the procedure. Maintain the client in the supine position for 1 to 2 hours. Apply heat packs to the lower back continuously for pain relief. This is also a teaching question, but it's a test-taking strategy to help you analyze question. You may not know what is this. You say, what is that? Vertebroplasty of the lumbar spine. Let me show you how to answer questions. You have no clue. Something should trigger you. Look, divide the word into 2. Vertebroplasty, right? And then you see lumbar spine. Therefore, you know it has something to do with the bone of the spine, right? And you know this vertebra is the is a vertebrae, basically, portion of your spine, right? And then there's a plastic. Plastic is always, it's like a plastic surgery. You're trying to fix it. You're just remodeling the thing. You're not taking it out. You're just shaping in a certain way. Therefore, there's a bone, vertebral bone. We're trying to what? Shape it certain way. That's all. What actually they do, they put something like a cement into that area to help it stabilize it, some caulk in there. And therefore, we are stabilizing the vertebral bone to stabilize it. What do you think after that procedure? Do you want to keep the patient in a high follow position? No. Do you want the patient to walk right away? No. You should put them in 1 to 2 hours supine position. After that, then they can ambulate. You can apply heat packs, for the inflammation. But what? Continuously. The word continuous, watch for NCLEX trying to trap you. Every time they say apply something continuously is always a trap. Therefore, this is wrong. Right answer is number 3, 1 to 2 hours. That's all. Then we can get them up. In a disaster, which of the following clients should receive priority during triage? A, airway breathing circulation. But I said Pay attention. Don't just follow that. Look at the situation. Crashing of your leg is hemorrhage, right? Open femur fracture is also hemorrhage. Burn to the face, airway problem. Laceration to the back, some wound problem. Who need to be seen? Number 3 is burn to the face. Therefore, is in trouble. And this is assessing the femoral pulse of a client following cardiac catheterization. Where should the nurse palpate to locate the pulse? This is a hotspot question. This is the physical exams. You should know where the femoral. This is your superior iliac spine. This is the pubic bone. The femoral vessel right like here. Right? So it's between the pubic bone, right, and the groin. So in the groin, between the hip bone and the pubic bone. At the popliteal is behind your knee, right? At the lower abdomen, above the umbilicus is too high, and the mid thigh is too low. So it's number 3 is your right answer. It's just anatomy, physical exams, nursing assessment. Which of the following laboratory findings should the nurse report to the provider immediately? A nurse is caring for a client with rheumatoid arthritis who has been receiving Etanercept therapy for 3 months. Most of these pharmacology questions, if you watch all my pharmacology review on the nclexrn YouTube channel, you master these questions easily. All you need to do, underline the keyword, Etanercept, used for what? Rheumatoid arthritis. That's something should tell you. Even if you have no clue, fine, you don't have to know what it is. But what is the problem? Rheumatoid, you know this is a what? Autoimmune disease. Autoimmune diseases are you want. What do you use? You use medication that can lower your immune system. Autoimmune, use medication that lower your immune system. Therefore, this medication is immunomodulator. That's all. That's all. That's how you think about it. Therefore, anything that will make your system so go low that you have risk of infection is your right answer. Which findings should the nurse report? Hemoglobin, it does not affect your immune system. Why count? 29,000. That's 2,900. That's bad. Platelets, 21,000 is normal. Creatinine, 1 is normal. Therefore, number 2 is what? Your right answer. You may have seen that it's low, but I just show you how you can figure it out just by using content that is an inflammatory problem. You lower your immune system, and therefore, number 2 is your right answer. And the last question, this one is hard if you don't know. The nurse is teaching a client with chronic kidney disease about dietary restriction. Which of the following food should the nurse avoid? Every time they give you a condition and talking about diet, go for the problem. Problem is kidney. What is the major problem with kidney? They cannot get rid of their potassium. They cannot get rid of their phosphorus. These are the 2 things they go for dialysis for, to lower their potassium and phosphorus. They are on medication to lower their phosphorus. Therefore, if you want to eat anything at all, it should not have potassium and phosphorus. One of the biggest medication that has a lot of phosphorus and potassium is prawn. This is Adapt Class. Thank you for watching. I hope you learned something. If you like this video, put the like button. Tell me what you think, which question trap you. And I hope you follow this series. Take care of yourself. Good luck. Best of luck. And keep charging as always. Bye.